In this episode of the Nurse Practitioner Podcast, Tracie Kirkland and Kimberly Williams discuss human trafficking. Thanks so much for your time today.
Thank you for having us.
Now, could you please give us an overview on what human trafficking is?
So human trafficking is a crime against humanity. What it really looks like is when someone is forced, fraud, or coerced into doing something that they really don't want to do. So when you talk about force, that means that an individual doesn't feel like they have an option, that they can't make another choice. So they may be pressured into doing something that they otherwise would not have been willing to do. And then when we talk about fraud, we're talking about when an individual was promised one thing, but then was given another choice or given something else. So let's think of a job opportunity that may have been offered and someone might have been excited about accepting that job opportunity, only to find out once they accepted the job or the opportunity that they ended up having to do something else and might not get paid to do it. So that is fraud. And when the coercion comes in, we talk about an individual feeling compelled to make a choice that is really against their will. Think about it in the case of if individuals might have been chosen to do something and then threatened with family members if they didn't make that choice. So those are the three main components of human trafficking: force, fraud, and coercion. And there's usually two types of human trafficking. We talk about sex trafficking, which is what we hear about in the media most often, and then labor trafficking. And so people are trafficked either by sex or by labor in a lot of different industries, almost every industry that you can even think of. And I'm sorry to say that people have been trafficked in the healthcare industry. But today we'll go deeper into what are some of the health consequences of human trafficking, what that looks like from the social determinants of health, and how as practitioners we can build an opportunity to build capacity for individuals like yourself to serve victims in the healthcare setting as well as in your community. Thank you.
Thanks for describing the term for us. What is the role of healthcare providers in early detection of human trafficking?
Great. Thank you for asking that question. So human trafficking is a worldwide problem, and many times victims have encountered healthcare providers. There's an emerging, alarming list of statistics that demonstrate that victims have at some point seen a healthcare provider, whether it was in the emergency room, their primary care setting. And what we're trying to do, or what we would like to do, is increase awareness through training. So there was an actual study that was conducted back in 2022 where over 6,600 participants responded. Approximately 23% were nurses, medical assistants, and in the healthcare field, another maybe 46% were providers. But out of that number, the individuals who felt that they were trained in detecting human trafficking or knowing the risk of human trafficking was very low. And the indication or the takeaway message was, and it is, that there is need for training grounds. And I'm going to defer to Kim because in Texas, it was mandated that healthcare training take place. And that occurred, was it maybe 3 or 4 years ago that this training?
Right. So in 2020, it became effective in the state of Texas that all healthcare providers must have human trafficking training. So for those who are in this space of anti-human trafficking space, that is, who want more awareness and education around this issue, it was very helpful that the state of Texas, HHS, put into law that in 2020, all healthcare providers have to have human trafficking training.
And thank you for sharing that information. That was one of the takeaway messages in this particular research, that if individuals had access to training, we would be able to do more, to see more, do more, and to provide what we call early detection for early intervention. And so the role of healthcare providers would consist of early detection with the aim of linking individuals to services using a community collaborative effort. And that's through caseworkers, social workers, through faith-based organizations, because it's a cycle. You identify, not in healthcare concentrate on the perpetrators, but we ensure the health of the victim, examining their risk for sexually transmitted infections, looking at health maintenance, and understanding that these risk factors can interfere with social determinants of health. And these are factors of where individuals live, reside, work, born, and or play. And what we do know is that addressing and identifying these victims early, we can improve overall health outcomes and mitigate them by assisting with food services, homelessness, access to health care, transportation, and the like. So it's multifactorial, and thank you for that question.
We appreciate you detailing the role healthcare providers play in early detection. Describe the intersection and importance of recognizing red flags as it relates to human trafficking and competency-based education for providers. How does human trafficking mitigation/knowledge relate to curricula overhaul in healthcare systems in terms of health outcomes?
So great question. Healthcare providers, when we provide early identification for red flags, we examine individuals who may come in through the emergency room, urgent care settings for repetitive sexually transmitted infections, individuals who may come in for repetitive urinary tract infections. So it's really important to ask who's behind the door, who's providing the history, and to really do a detailed history in order to tease out and understand environmental risk factors and social risk factors that may place individuals at risk. One of the things that we do and we teach in our healthcare training programs is to really take a good, thorough medical assessment. So individuals who are presenting to healthcare providers, they have an individual that's accompanying them. They're telling the story, and the actual patient isn't able to tell the story and to speak for themselves and or refuse to leave the room. That's a red flag. That should query or lead to thought, is there something else that's going on? That's a window of opportunity to ask that individual to step out of the room, that you need a few minutes of privacy to be able to engage with that patient. Now, the intersection or the importance of why it's needed in healthcare organizations, as we have an overhaul, and especially in nurse practitioner programs and in undergraduate programs, to include competency-based education, it allows us to identify these gaps and to create new educational models where we are doing simulations, where we are allowing interdisciplinary care and interprofessional education in order to identify individuals who are at risk. So it's multifactorial. It takes a village, as it's coined in society. It takes a village to be able to identify patients and to link them to appropriate services.
It sounds like integrating human trafficking education into healthcare training enhances providers' ability to spot red flags and improves health outcomes.
Absolutely. Well stated.
What are suggestions related to patient-centered care?
Suggestions related to patient-centered care involves, again, early assessment, detection, but also discharge planning. Discharge planning, and I'm dating myself now, discharge planning starts day one of admission. So that individual who presents to the emergency room, who's later admitted for whatever a particular reason, their discharge planning should engage or involve caseworkers, social workers, chaplains, and other community or faith-based organization in order to ensure that that transitioning period is appropriate. And as my colleague will share in a few minutes, it sets the stage for job reentry and training. It sets the stage for educational opportunities as we talk about educational determinants of health. And it just provides resources as we address food insecurity. Because what we do know in terms of population health, the increased number of victims are generally Black, and they're generally Black women. So it really allows us to provide patient-centered care that addresses health maintenance, that provides appropriate women's health, to provide appropriate pediatric care, and to assess, to link them to services like women, infant, and children, because oftentimes they have children and they're trafficking because they're trying to feed their family. So Stay tuned, more to come by my colleague here.
We appreciate you sharing those suggestions. How do factors like access to safe housing, nutritious food, and education impact the recovery of trafficking survivors?
It has a lot to do with impacting the lives of trafficking survivors. Once identified in the hospital setting, as Tracie alluded to just moments ago, it really takes a whole community response to be able to support a victim on their road to recovery. Human trafficking is a very traumatic event. Some victims state that they have post-traumatic or diagnosed with post-traumatic stress syndrome. And so these obstacles that are in their way from recovery, we have to work alongside them to try to help navigate them to the correct resources that will not re-traumatize or provide harm or give harm toward the individual patient, but that will provide wellness and wholeness and hopefully healing through that process. And so addressing the social determinants of health, even after they leave or discharge from the hospital setting, gives them an opportunity to prevent human trafficking from happening again in their lives or the lives of their children or their family members, because we can recognize and support the victim on a longer journey. And so really also looking at building the capacity through the collaboration with different partners are so important in helping victims. And we keep saying victims, but I also want to note these individuals, the individuals who we may encounter, are actually survivors and overcomers of a circumstance and shouldn't always be named a victim. You know, when we're writing grants or when we're sharing stories, we use that to kind of identify them initially to let them know that they have been victimized. But more importantly, we want to take home the fact that they are survivors, right? And they have overcome quite a bit, and there's still a lot that they will overcome. And so in that overcoming aspect of their walk, we can name that as overcomers. So we can name them as overcomers and having a lighter lift on this experience. I think I've gone too far with my answer, but go ahead.
Excellent. Excellent.
Thanks for breaking down how these factors affect trafficking survivors. What strategies can be used to address the socioeconomic barriers that hinder trafficking victims from achieving long-term stability?
So when we talk about some of the social determinants of health, we also know that the socioeconomic status of an individual, where they live, where they work, where they play, how they interact with their community can have so many effects on an individual's life. And so those strategies to address that can look like, how can we help an individual first access the healthcare needs that happen after discharge from the emergency room or the clinic where we may encounter them initially. So that may look like referring them to smaller clinics or finding them a medical home that specifically looks at addressing the specific needs that they have. So think about, if you have been trafficked, you might not have had any dental care throughout your captivity, right? So I would love for all of us to think about the last time we had a toothache. Were we able to do anything while we had that toothache? Absolutely not. Our first goal was to get that tooth fixed and to get in with our dentist or orthodontist right away. So for traffic victims who haven't had an opportunity to see a dentist in years, can you imagine the amount of decay and the amount of pain that that individual might be in? So what if we as providers could help refer those patients to a clinic that provided free dental care for victims, right? Or survivors or overcomers. Also think about if you have been in captivity and your healthcare needs have not been taken care of. And for many of you who may wear glasses like me, one of the strategies might be identifying a clinic or an organization that will provide free glasses for an individual to see. So once you can see and once your mouth has healed, maybe from the trauma that you've experienced, now we can talk about overcoming some of the socioeconomic status barriers that may have been present. So many people find that when they get their teeth fixed, they are often able to smile more and often able to feel comfortable enough going on a job interview. Or if you have glasses now, you can see the forms that you have to fill out. or use the computer and see the screen so that you can fill out an application. So it seems very basic to us, but those are huge barriers for most individuals who have been trafficked. And this socioeconomic gap that is created because of minor health care needs can be addressed quickly to support a victim or overcomer or survivor through their journey.
Excellent job.
These are important distinctions to be made regarding socioeconomic barriers for trafficking survivors. How can organizations collaborate to improve transportation, employment, and healthcare access for survivors?
There's so many different ways to collaborate with community partners. If you look around your community, there are already organizations in place that are doing a lot of this work, maybe for vulnerable populations or underserved populations already. What I like to recommend is identify the organizations within your community that are already doing great work. You probably already have a clinic nearby that's providing free dental services or dental services at a minimum cost. You probably already have a domestic violence organization in your community that's providing housing, emergency housing for domestic violence victims. What if you, now that you know more about human trafficking, at least have a basic understanding of it and have identified the red flags and have looked into how you can support within your hospital setting? What about creating a resource list within your community of all the agencies that provide this kind of care that would support these individuals? So if you think about it from that aspect, and what if you could visit those organizations and maybe provide a basic training that will give them more information about human trafficking and say if there's a way that we can partner with you and refer some of our clients or patients to your organization so that they can receive the continued care that's needed. Sometimes the handoff can be hard, right? Any of us, when you meet a new person or you get introduced to a new person, it's hard to do that first cold call to somebody you really just don't know. But when someone does a virtual introduction for you, or when someone that you know is standing beside you and can give an introduction for you, it makes you a little bit more comfortable going into the conversation about whatever it is. So think about that same concept with a trafficking victim or survivor. They are on a new road to recovery. They don't know about any of these services that are provided in many cases, and they're just trying to find their way. So if they lack transportation, maybe identifying with here in Houston, it's called the Metro system, finding a way to get free rides or vouchers so that they can get transportation to whatever agency that can provide additional services to them. And what if that warm handoff looks like you actually introducing the patient to the organization as a warm handoff to that case manager that may be there? There are several steps that can be used to support victims on their journey, but most important is using the strategies to help overcoming the barriers that are in place for them at that time. And how can we do that and mitigate any of the challenges, or minimize is a better word, the challenges that they face so that they can get to the next level in their life?
I would like to just piggyback off of that because, again, as it relates to the healthcare provider, as we're using valid and reliable instruments in our clinical settings to screen for like mental health, using the PHQ-2 and the PHQ-9 and utilizing the GAD for generalized anxiety screening tests and using the food hunger vital sign, once we are training individuals to incorporate these training and assessments of our patients, our overcomers, which I really like the term, when the patients are found to be positive, then we can link them to these community services. So as we go back to the initial questions that you were inquiring about in terms of what is the role of healthcare providers, we need to use valid and reliable screening tools that are now a part of our value-based care or metrics that we are scorecarded to make sure that we're including in our health assessments. And again, that's only one step. The second step is when they screen positive, who do we turn to?
And that's so important because think about it from the aspect of who do they turn to? And if you already have a list available as a practitioner in hand, it becomes easier for you to do a warm handoff to someone who needs help. Housing is a huge obstacle for survivors of human trafficking. It's a huge obstacle for a lot of people right now. But I believe for traffic victims, it really becomes a even more challenge because housing is limited. Housing is expensive. And if you've been trafficked for long periods of time, you might not have credit worthiness to be able to get a place to stay. So think about the agencies in your area that provide emergency housing, short-term housing, or long-term housing that will fill an immediate need for a safe place for an individual who's experienced trafficking.
Collaboration among these types of organizations sound integral for survivors. What are the most effective ways to build partnerships with other organizations to enhance support for trafficking victims?
Here in Houston, we have a lot of resources and we're blessed to have those resources. And some of those look like coalitions, consortiums that really pull together different partners within the community so that they know how to serve individuals who've experienced this horrendous crime. So if you have a consortium in your city, like in Houston, it's the Houston Area Human Trafficking Healthcare Consortium, and that's for a healthcare specific group. There's also HATRA, which is Human Trafficking Rescue Alliance, which is focusing on the law enforcement group. And then there may be other community partners, like for Houston, it's United Against Human Trafficking, and they have a coalition. Maybe participating in some of those organizations, finding out who the key person is who's over those coalitions or consortiums or associations, and inviting them to speak at your next staff meeting or seeing if you can attend those events would be a great way to build up relationships and to build collaborations and partnerships with organizations in your community that are already doing the work. So sometimes we may think we have to reinvent the whole wheel, and that could be nice, but there may be already resources already in your community that are doing this work, and it's a little digging. Once you identify them, I would say email, call, and have a meeting with them to see what their goals are, how you can support them, and vice versa, how they can support you in taking care of individuals who've been harmed.
Thanks for sharing those helpful tips. How can collaboration with local businesses, government agencies, and nonprofits create a more comprehensive support system for survivors?
As we mentioned earlier, many survivors have lost everything in their life. So building these networks really become very helpful so that they can grow. Some of those that I would think of initially are with the organization Faith Collaborative, who I'm the CEO of. We look at how we can create these entities to support victims along their journey. And so what that looks like is that businesses such as organizations like Marriott will provide safe housing for individuals. Emergency stays is what they're called, I believe, and I may have to correct that. Emergency stays, so that if an individual is identified and does not have a place to go right away, that Marriott would be able to provide a stay utilizing a nonprofit that's in that local area. So in our local area, that would be Faith Collaborative, a nonprofit organization committed to serving victims of human trafficking and also empowering them on their healing journey. And so employment opportunities may also be a way to support individuals who've been harmed in this way. And so when we think about employment the right way, not employment the trafficked way, but looking at opportunities to do like job readiness training. So Faith Collaborative, in collaboration with the FIT Hospitality Training Program, really works with the American Hotel and Lodging Association, as well as Marriott and the University of Maryland Safe Center to promote job readiness. There's several modules that focus on market-driven skills to work in the hospitality industry. And so if we think about, that's one industry, hospitality, working to create a difference in the lives of individuals who've been harmed. How many other industries, businesses, nonprofit organizations can give an opportunity to an individual who's been harmed so that they can grow and be able to take care of themselves and their families, but also give them a sense of hope and a future that has been taken away from them and they've been stripped from for a period of time. So businesses, governmental agencies, as well as nonprofit organizations can have a really huge impact on supporting individuals who find themselves as trafficked.
And to add on to that, because we could just go on and have a part 2 and a part 3 to this, but it's really important to pull in the role that schools are playing and transportation systems and barbershops and nail salons in terms of having signage in these particular places to dial the certain number, a specific number, if in the event you feel that there are individuals who are at risk or are being trafficked. So the school systems are playing a large role here in terms of community partners. We have the public transportation. And then on the national level, we have airports. In Atlanta, Georgia, there was a consistent messaging that was taking place over the past few years. Here in Houston at Bush International, we have signage behind the doors and on different canisters. So there's an intersection with a lot of different public entities. And to just go back even further, when we think about risk factors, we think about national disasters and we think about large sporting events where we see an emergence, an increased episode or increased number of individuals who are trafficked during Super Bowl, during, for example, when we had different hurricanes that occur here, during COVID. So these are different things that we would like to illuminate and allow our listeners to know that these are instances where we should be a little bit more vigilant. And also, I would like to ask Kim to share risk factors in terms of the age. And then this is probably a great concluding point because we did not highlight individuals who are at risk in terms of from an age perspective.
Absolutely. Thank you for bringing that up. I will note also before we go into the age aspect is that even in Houston, our healthcare institutions, our emergency rooms, or in clinics are required to have human trafficking signage up in the emergency rooms. So think about that for your healthcare institution. If you're outside of the greater Houston area, that's a wonderful thing. And also you mentioned about the nail salons. You're right. So nail salons, hairdressers, or stylists, all of those are supposed to have signs up in the state of Texas. So if your state does not have anything like that, this would be a great advocacy issue that you can do. And maybe you can reach out to us and maybe we can find the House bill that is associated with it and it can be a starting point for you. But to the point of the average age into human trafficking is 12. And you see a huge uptick between the ages of 11 and 14. So we're not talking about adults who are able to make their own decisions at all. They are children. These are minors who are being influenced by other people to do things that are against their will. And think how impressionable young people are anyway. So when they're forced and frauded into doing things that they know they shouldn't be doing, they feel like something is wrong, they really don't feel like it's an escape. And sometimes that can be familiar trafficking also, which can happen right in their own families. So there was no recourse. There was no way out from their perspective. And so having people who are diligent about identifying ways to support victims and to identify the red flags are very important. And some of those red flags may look like they're presenting, saying one thing about what happened to them, but what we see is something different, right? So the presentation doesn't match up. You know, if the individual has moved from city to city to city, have quite a few hotel keys, have many cell phones, and having to be on that cell phone at all times may be an indication situation that they are having to report in their every move, right? Or that they're staying at different hotel rooms throughout the time and don't have a stable living environment. And with homelessness being high, I do realize that, people that may happen to individuals who may not be trafficked, but that may be one red flag that helps you look a little deeper into why this individual has those hotel cards, keys. And then if you also want to think about individuals who have a lot of tattoos. Just because you had tattoos does not mean that you've been trafficked, but tattoos can also be a form of branding. And so asking questions about the tattoos in a very non-confrontal way, but just out of curiosity about the tattoos. Many people who get tattoos on their own really are excited to share what the tattoos mean. But if someone may shy away or feel embarrassed or feel like they have to explain an individual's name being placed on them, that may be cause for you to ask a few more questions during your assessment. So these are some of the red flags that we want to keep before you so that when you encounter someone who has an inconsistent story or has a history of moving around a lot, those will be key signs for you to dig deeper, assess longer, and also to give the patient an opportunity to disclose what may be happening in their life and how you can support them. And I want to drive in the point a little bit about you supporting them, right? Every victim may not want to come in and say, hey, I'm ready to get out of the life and I am a human trafficking victim. That's probably not going to happen. Many people don't even know that they are a human trafficking victim or even recognize the term human trafficking. But you, now being trained and having a little bit more knowledge and more knowledge that you will continue to get, you now have the language to be able to ask, have you been tricked? Have you been forced? Have you been coerced into doing something that you really don't want to do? Has funding of money been held from you when you work? Those are all some good questions that may help you dive a little deeper in your assessment and get more information from the patient.
Next, how important is a sense of community in the recovery process for trafficking survivors?
It is essential. I was a presenter at the DFPS conference for the state of Texas last week. So that's the Department of Family and Protective Services. There was a wonderful survivor who provided her story and shared more insight about her particular journey through trafficking and now on the other side of trafficking. And one of the things that she mentioned in her speech was around community being the way to end human trafficking. Those were not her exact words, but that is a paraphrase of it. Because when you have a community that checks on individuals, that supports individuals, that prevents trafficking from happening, that is the way that we eliminate the ongoing abuse, the ongoing fraud, the ongoing coercion. Because you have accountability partners, you have support systems in place that breaks through all of those social determinants of health to take care of the individual right where they are. What has happened to many victims of trafficking is that they have been removed from their community, right? They have not had the opportunity to reach out to those who can support them through their journey. They have not had the opportunity to go to school in some cases or reach out to some of the resources that are in our communities to support them. So if there's a way to create a new community for survivors of human trafficking, you create an environment where they can seek help and receive the resources needed to access the information and support themselves on their way. So think about this. If we open up the floodgates of access and information and support, we give them an opportunity to heal and step outside of a traumatic situation and step into a new world where they are able to overcome every obstacle that they have encountered. And that's what creating community does. Think about it as in the school ground where we all played as children in many cases. So when you were inside the playground, you had a community or a group of people that were your friends, right? Every now and then someone was hurt and may have been sitting outside the circle or outside of the playground and felt alone and not received the attention that they needed. But it was always comforting to know that someone would come outside the circle to go and help and walk along someone else who was alone on the side. This is what we're talking about in community. There have been individuals who are outside of the circle, figuratively, right? They haven't had the access to be able to come inside the circle so that they can understand and learn how community works and be supported on their journey so that they can see their healing actually taking place. We heal in community when we have support and access to information and resources so that we can grow and learn together. Thank you.
Finally, what can be done to foster a sense of belonging and connection among survivors as they rebuild their lives?
We have a program that I enjoy at Faith Collaborative, and it's a program called Dining with a Purpose. The goal of the program is to bring great community with survivors of human trafficking so that they can learn from each other as well as learn from community members about how to do this journey called life together. So not all victims come into relationship and community at the same time. So you have some that have recently exited the life. You have others that have been out of the life for a longer period. So when all of those individuals get to come together, sit around the table and eat and share a meal and share a topic and even bring any concern that they may be going through at that point in time, it gives a chance for everyone to play a role and to support one another. And so dining with a purpose isn't just about eating a meal. It's about creating a community and an environment where trust is learned and also community is felt, where individuals are valued and appreciated for supporting one another. And think that looks different from when an individual was in their captivity, right? So coming out and having people who really want to see you succeed and are willing to walk alongside you so that you can see success is a paramount of the Dining with a Purpose program. But there are also other ways. For many people who are spiritual, they may find community in a church environment, in a mosque environment, in all of those kind of environments, in a temple environment. Those environments create opportunity where they can meet other people with a common spiritual guide. And when we think about emotional health, we also have to bring in spiritual health into that, right? So we can address the emotional, but it's hard to address just the emotional without touching on the spiritual. So if you can find a spiritual community that an individual would like to go to create an even larger community of support for a longer period of time that grounds them, that also helps them in their healing journey.
Tracie and Kimberly, thanks so much for your time today.
Thank you.
I
hope we did you justice.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at the Nurse Practitioner Journal, and on Twitter at TNPJ_journal. Thanks for listening. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Please note that the hosts of the Nurse Practitioner Podcast are not clinicians. However, we created the Nurse Practitioner Podcast to bring you relevant clinical information by NPs for NPs. Thanks again for listening.